Hi everyone, this is Ziyuan covering the current situation in the city of Nangong. So the reason why I'm wearing the protective suit is I'm not traumatized the situation here is because this is the only fever clinic in the city of Nangong. So what that means is when a patient has reported having a fever, the ambulance and also related medical department will send the patients over here. So the current situation inside, right here, the reason we can't get in just because safety reasons. And the current situation is there are 23 total beds in this community health service center, and two of those patients have reported fever. Turned into positive confirmed COVID-19 patients. So two of them left. So what that means is this morning there are 21 of patients staying here. And then according to what I known from the officials there is one person coming in right around noon. So what that means is there are 22 patients in these fever clinics now. And the reason we are standing here is because, as I mentioned, it's a community health service center. So it's not like a hospital. It's all equipped and prepared for such situation like a COVID-19, and also service the fever clinic function right here. So actually we speak to the people in charge, especially the medical workers and leaders in charge of here. Is what they are saying is so the fever clinic is now here. They have renovated the location within 24 hours. And then within those 24 hours, they kind of change the room, bringing equipments, send doctors here. And the people who are in charge here is from the city of Xingtai People's Hospital. So those are the doctors who are inside, who are working inside is 80 medical workers, include those experts in different areas. So according to what I've known from the head who is in charge of the medical workers inside, so a total of around 80 medical workers are working here to support the function of the entire fever clinic. So what that means is now there's one bed available inside, 22 patients, 80 medical workers include nurses, doctors, and supporting workers to get this function. And then they made the diva today. The reason why we are here is because, as I mentioned, it's just a fever clinic, and then it's turned into a fever clinic, but before it's a community health center. So it doesn't have a CT scan function or it lack of such equipment to support the prevention method and control methods here in Nangong. So the good news for the people here is Wuhan Zhongnan Hospital of Wuhan University sent this vehicle carry mobile CT scan right here. What's this mean for a city like Nangong? It can conduct 300 chest scans per day. So what that means is the 22 patients here have already done their scan. So when people come in, they got the capability of doing what's needed in here. So some might wonder, what does mobile mean? What does really this vehicle mean? And why it's so important for a fever clinic that's established here? It's because the fever clinic doesn't have the capability of doing the CT scan. And this can send the CT scan schedule via 5G directly back to the hospital in Wuhan. The expert there will immediately give a medical reports and feedback to those doctors here, so they can work together. So it's a collective effort from local medical workers as well as the workers from. I know some people might worry because I'm having my notepad here and pen, and also my phone is out. I'm assure everyone I will definitely spray and really disinfect everything that I'm holding right here, including myself, to make sure that both my cameraman and it's safe. So don't worry about that. But we want to show you this is what's happening in the city of Nangong, because previously we have been keep staying in Shijiazhuang, update the situation right there. But today we are in it's the size of it. It's like a township, but it's a little bigger than that. So it's like we call it Nangong City, and this really helped the effort here because the People's Hospital is closed off for the prevention methods, and also those people who can take care of all the exams and that is here. So this fever clinic it's like the gate. Think of it as a gate to help to see what's the reason of those fever. So the doctors say once they bring in here, they will first do the nucleic acid test immediately to confirm whether the patient is just a flu or just got a cold, or it's really something about COVID-19. So this is a gate to redistribute everybody to the place that they're supposed to be, instead of using all the medical resources here, especially the city and also pretty much the nearby region is on very high alert about the COVID-19 situation right here. And let's take a look. Let's walk over this way, because we are all, you can see we are wearing other protective suits, so my cameraman can't hear me. I have to signal a little bit in order for him to follow me. So let's turn the camera to right here. You can see those, they even got the stickers here, Wuhan Leishan Hospital, as well as where the truck is coming from. I want to describe it as a truck because according to the information I know, it's 23 tons and it's worth 5 million yuan, I believe, for all the equipment to have it all set up, connected to send signal back home. So let me give a full look to the entire truck. And you can see the little window is right there. And so according to the medical worker I speak to, the situation here is not really what they see from the patients that got into the hospital. Is the symptom-wise, what they need is not really different from Wuhan. So it's the point of their duty here is to really, as I mentioned, to understand if you really got a cold, if you got the reason of the fever. The reason you got it might be the cold, might be the flu, might be the COVID-19, but it might be really about other things. So the reason why they're here is do other checkups, know what's happening, and then figure out what is happening. And let's walk over. Maybe let's walk this way and see if we can find someone to talk to. So my colleagues here is doing their interview in Chinese. So the expert will let us get into the vehicle later. It's like the honor badge to showcase they've been through Wuhan, and they are now here to help with what's happening in the city of Nangong, and they're getting into the truck. Let's see, and this is how they're getting into it. So there are a lot of equipment inside. We don't want to get overcrowded and interrupt how the machines are working here, because we know what they are doing is definitely the priority. We are here just to show you how it really functions. And of course, we know it's for CT scan. So it also has signal to say beware of the radiation here. So the vehicle has finished its final adjustment. According to the medical workers, all the people here already got their CT scans. So for now, there's no one having the need to do that. And they're rebooking equipment here, and my cameraman is stepping up to give you a full inside look of what it looks inside. Meanwhile, let me introduce you with a few backgrounds. So the truck, let me clarify, because it's huge, and as I mentioned, it's 23 tons. So don't get mixed up and all that. It's actually a huge truck for me in my heart. But I know it's called Vehicle Carry Mobile CT Scan. And meanwhile, how they got here on Sunday, and then it was a 20 hours drive from Wuhan to right here to the Xingtai city of Nangong, and then 2 drivers relay. And I want to share with you a little background story of who the drivers are. They actually volunteer to work with the hospital during Wuhan. I feel like it's like a touch and warm story because both of them drove ambulance to transport patients at that time, and they both volunteer at Leishanshan Hospital. So you found a connectivity to really want to give a hand to those people who need help and get the medical help as soon as possible for this local patients. So this is the reason why we are here. And also, we want to show you they are working every minute. If there is a need, they can assist the local prevention and control methods. They will do that. So what are you seeing now is, as I mentioned, they can communicate directly with the expert behind the scenes at the Zhongnan Hospital of Wuhan University. The expert right there, because obviously you can't physically send a lot of people here for the prevention and control method, but the expert will stay behind the screen, give diagnosis and also analysis as soon as possible, because you can also send it across the country if there's a need. But for now, this is the support from Zhongnan Hospital of Wuhan University. And I speak to them today. Tianjin also sent 8 ambulances to a nearby area to support the effort. So everyone can find a way to help to do the effort. And this is what we have for now. I know you got a sneak peek of what's inside. I haven't got into it yet, but that's what we have for the truck. I know this might be a relatively short live stream in comparison to what I've done previously, but just because, the priority here is definitely take care of the patients inside and also have those work done as soon as possible, to know whether to send those patients to the right hospital, to the designated hospitals for confirmed patients, or send them somewhere else and not occupying the medical resources. And then what they're doing for preventing the virus spreading is on that side, as you can see, you can see the red fence. So the medical workers are changing over there, and but where we are now is a place that it's for CT scan and for having the place ready to receive patients. So it's separated. So it's a clean area on that side. It might be an infected area on this side. It's all for the sake of the purpose of prevention and keeping the medical workers safe, no cross-infection, and get the work done as soon as possible. So let me wrap up here. This is the CT scan vehicle from Wuhan, and we really hope that this will come under control as soon as possible. It's under control. There is, I believe, there is no new confirmed cases by today, but it all has to depend on the press conference in the afternoon, because they will give like an official update there. But according to right here, there's no cases right here today confirmed as the COVID-19 positive. But one additional new patients are sent to the hospital. So we will see. We'll keep bringing you the latest, and that's all I have for now.